Did you know that every single day, 91 Americans die of opioid use overdose? Many people are unaware of this growing crisis, but today I'm going to reveal the truth about the opioid epidemic. I'm credible to speak on this topic because I've done much research over it over the past couple of months. This opioid epidemic has become a national crisis, and I'm going to share with you the history of opioids, the statistics that made this problem an epidemic, and what the country is doing to stop it. So, what is the history of opioids and how is this epidemic starting? In the 1990s, pharmaceutical companies began producing opioids like OxyContin that were marked as safe to use and non-addictive. This was before they knew that they would be addictive. First off, opioids are narcotic pain relievers that work by reducing the sending of pain messages to the brain, therefore reducing feelings of pain. They are supposed to be prescribed to only people who need them with chronic pain, like cancer. However, according to the National Institute of Drug Abuse, 1 in 3 Americans were prescribed opioids in 2015, which is way more than the amount of people who suffer from chronic or cancerous pain. Because of this overprescribing, the NIH says that 29% of these patients misuse their opioids. It is such a growing addiction because opioids are given by doctors, so there's easier access to them. This leaves out the 828,000 people who use illegal opioids like heroin and fentanyl. This is a picture of a woman who started using heroin. This is before, and this is after 1 year of using heroin. So this is just an example of someone who is using heroin. So we get that people are addicted to this drug, but what makes the opioid addiction an actual epidemic? Well, the reason is because the numbers of deaths and misuse of opioids are huge. According to the Department of Health and Human Services, in 2015, 12.5 million people misused prescribed opioids. 33,000 people died from them, and 13,000 people died from heroin. The number of these deaths has quadrupled since 1999, says the NIH. The scary new threat among the opioid epidemic is the growth of fentanyl. Now, fentanyl is an opioid that is prescribed to cancer patients and is 50 times more powerful than heroin is. In just 2 years, the number of fentanyl deaths increased by 600%, killing 4,000 people in the U.S. in 2016. An amount of fentanyl as small as 3 grains of sugar can be deadly, and it is actually the drug that Prince died of. This drug is flooding into communities, and the NIH predicts that since it is so easy to overdose on, the rate of overdoses from fentanyl will increase. Overall, prescription drug misuse has costed the nation $78.5 billion in health care. And the National Institute on Drug Abuse has realized that there needs to be a change. They said that the scope of this crisis is staggering, but it is not hopeless. They have constructed a plan to end this opioid epidemic. First, we need more overdose reversal interventions and improved forms of naloxone, which is an overdose reversal medication. These are used to stop the effects of the opioid before it kills you, and it is recommended that users carry this around. Second, there needs to be new innovative medications to treat opioid addictions. There have been medications used to stop the illicit use of opioids, but patients rarely ever stick to the treatment plans. New vaccines are being attempted that have already shown great promise in animal studies. Thirdly, we need to develop safe and effective non-addictive treatments for chronic pain other than opioids, since most people who get addicted to opioids begin by taking them as prescriptions. So, by reducing the medical use and supply, the rate of addiction and overdoses would go down. The NIH is partnering with the pharmaceutical industry to develop new treatments. Overall, it is obvious why the epidemic is a national crisis because of its history in America, the statistics and numbers of deaths, and the need for prevention. Even though the facts I have shared with you today seem unnerving, there is still hope that the epidemic of opioids will cease. Thank you.